This presentation includes PowerPoints with voice recording as well as video demonstration. The video demonstration is important for the actual demonstration of how to insert an IV, and the PowerPoint portion includes pictures and important information about what IVs are, as well as common complications that occur with IVs. This presentation is intended for nursing students wishing to learn about IV insertion and monitoring for complications after the IV is inserted. The teaching will be presented to people in the young adulthood stage of learning, to whom Bastable and Meyer suggest have their main motivation for success in careers and self-esteem. Therefore, the topic being about a skill useful for developing their career in nursing, presented in a clear technological method that connects with the multimedia knowledge that people in this age group possess, will be a great way to educate and engage the intended audience. We expect our audience to be a nursing student or multiple nursing students who are in their first semester and have no experience starting and or maintaining IV lines. The nursing students would have already learned about universal precautions and personal protective devices. They would also have had exposure to anatomy and know landmarks for venous access. The presentation is intended for nursing students wishing to learn about IV insertion and monitoring for complications after the IV is inserted. The information will be presented to nursing students in one of their classes before they enter a clinical setting to prepare them for starting IVs and monitoring IVs. One of the most important skills a nursing student can possess is successful IV insertion. Nurses who can insert IVs skillfully, causing little pain, and who are knowledgeable and conscientious when complications occur, are valued in this profession. This presentation will define what an IV line is, demonstrate the items needed for IV insertion, and how to insert an IV, as well as describe common complications that occur during IV therapy and describe specific interventions for said complications. The three learning outcomes for this presentation are: 1. In a clinical setting, nursing students will be able to start an IV. 2. When caring for patients receiving intravenous therapy, the nursing student will be able to identify if a complication occurs related to intravenous therapy. 3. When caring for a patient who has a complication related to intravenous therapy, the nursing student will be able to provide the appropriate interventions for the specific complication. The first topic this presentation will cover is the definition of an IV line. Intravenous line is made up of two primary words, intra and venous. Venous refers to veins, the vessels that carry deoxygenated blood back to the heart. Intra means in, so an IV line is a line that goes into the veins. Nurses use intravenous lines as access to veins to give blood, medications, fluids, and also retrieve blood for labs. There are two types of IV lines. The first type is a central IV line. These are inserted in a vein and go directly to the heart. The photo in the top left corner is a PICC line. It is inserted into the arm and goes directly to the heart. The photo to the bottom right has a subclavian vein and an internal vein insertion point, which is in the front of the chest or in the neck. And again, central lines go directly to the heart. The other type of IV line is a peripheral IV. For this line, a needle with a small catheter is inserted into a vein, usually in the arm or hand of the patient, and the catheter remains in the vein peripherally or outside of the heart. Next, we will show you the video of IV insertion being demonstrated, as well as the different items needed for inserting an IV.
Materials needed for an IV start. So here's just an introduction to some of the IV gauges. So this one right here, this is a 22 gauge IV. It's the smallest one of the three that we have here. And this pink one, this is the 20 gauge IV. This is good for, this is the lowest gauge you can have if you're administering blood. And this is an 18 gauge. This is the biggest one we have on the acute care floor. There are bigger gauges that you'll find in the emergency room, but this is generally the one that is started in trauma situations. Here you have your piggyback tubing. Often people will use this to hook onto the IV catheter after you start it. It's always important that you prime this tubing with some saline before you hook it up, before you even attempt to start an IV. And this is a saline flush. Now this is what you would use to prime your tubing with, and to check that the IV is in the vein by withdrawing blood, and and then you would flush, making sure that it flushes without a problem. And IV start kit is very important to have, and this has some of your essentials that you will use when you go to start an IV. In it you will find your tourniquet, your alcohol, and to use this you have to snap these two things, and then you shake it a little bit and you clean the area, and you'll clean in the circular motion and inner to outer. You'll also find your tegaderm, which is the clear dressing that you will put over your IV after you start it, and a little 2x2, and you can use this 2x2 gauze under the IV catheter after you start it, or you don't have to. It depends on where it's located. Sometimes it's good to have this to anchor the catheter up a little bit so that it goes into the vein a little bit better, but it just depends on what the situation that catheter is in. And here you have where you can label date, initial, and label the date and initial of the dressing change that whenever you after you stick on the tegaderm over the IV catheter. And here you have some tape. It's essential for starting an IV. My name's Perdita. I'll be doing the IV insertion on you today. Do you have any questions? Okay, so I've washed my hands, performed hand hygiene, I've got gloves on. So now I'm going to start the procedure. Okay, I'm going to start by identifying a vein, a possible vein, and I'm going to apply the tourniquet. I have all my equipment ready. Got my piggyback tubing, my IV tubing primed and ready to go. What you're going to do is you're going to clean from inside to out in a circular motion with an antiseptic wipe. And you're going to let that dry completely for a minute. And meanwhile, I'm going to get my stuff ready. Okay. Alright, minute has passed. Now I will apply the needle. Okay, you're going to have to apply it bevel up at a 15 to 30 degree angle. And hold with your non-dominant hand the skin taut as you go in. I've got flashback. Solid band. And then you're going to hold down above the catheter after you've pulled out your needle to stop the flow of blood, and then you will carefully apply the piggy tail onto the catheter to see if you can get blood return. Okay, I got blood return, and then I'm going to flush the catheter in, making sure that it doesn't bubble above this region. And it is going in well. Okay. Then you will secure it. And you have to be very careful that it doesn't come out of the vein while you're doing this. So I'm just going to secure this one across, but there's different methods for securing it. Okay. Now it's loosely secured, and I'm going to put a tegaderm over it, just to keep it aseptic. I'll place a tegaderm over it. I'm going to use an alcohol swab to scrub the hub of the extension tubing and just flush the rest of the tubing so that it's clear and that there's no blood in the tubing. I feel okay. Any pain? You're going to feel around after you have the infusion going to make sure that there's no redness or swelling. And then I secure this part with some tape to make sure that it doesn't pull on anything, because the extension tubing can get caught on different devices and lines. And you'll close it off as well with the clamp right here to make sure that air doesn't get in. It just kind of keeps the whole system a little bit more clean. And then you'll get rid of your tourniquet.
The next topic we'll discuss is complications from IV starts.
You've started an IV. Now the fun begins. You must monitor the site for signs and symptoms of an IV complication. These can include infiltration, phlebitis, hematoma, and extravasation. Infiltration occurs when fluid escapes from the vein and enters the surrounding tissue. This can be caused when you miss or blow a vein, meaning you puncture or nick part of the vein, or when the patient moves or pulls at the catheter, causing it to come out of the vein. As you can see, there are examples of a normal IV site, one with a mild infiltration, one with blistering, and one with severe infiltration. To prevent the probability of an infiltrate happening to your patient, use aseptic technique when you're starting the IV. Monitor the IV site per your hospital or facility policy. Remember to document that you checked on the IV site and what it looked like. Instruct the patient to report any pain, swelling, discomfort, anything around the site. If pain or swelling occur, stop the infusion, remove the IV, and restart it in a different location above the site that just infiltrated. Elevate the extremity, apply a warm compress, and always notify the MD. A hematoma occurs when blood leaks out of the vein into the surrounding skin. This can be due to the initial IV stick, or it can occur after the IV has been started and the needle is being removed. In this case, applying pressure for several minutes to the site could have prevented the hematoma. If a hematoma forms, you will notice discoloration of the skin, swelling, pain at the site, and/or inability to advance the catheter. If you notice any of these signs, you should remove the tourniquet, remove the catheter and the needle, apply pressure for several minutes, apply a cool compress, document any and all interventions taken, and notify the MD. Extravasation occurs when the catheter comes out of the vein, leaking fluid or medication into the surrounding tissue. You will notice swelling above the site, pain, burning. The skin will feel cooler than the rest of the body. You will not have any blood return in the cannula. If this occurs, stop the infusion, notify the MD. The patient may need an antidote depending on the substance. Apply a cool or warm compress and document the interventions. You may need to photograph the site. Phlebitis occurs when the vein becomes irritating, causing redness, pain, swelling, warmth at the site. The patient's temperature can increase. Prevention of phlebitis would be to use a more appropriate vein. Do not use the smaller veins. If you notice on your patient that phlebitis has started, stop the infusion, apply a cold compress, document interventions, notify the MD, and you will want to restart the IV in a different site.
For the summary of this presentation, we will review critical points for IV catheters. There are two types of intravenous lines, central and peripheral. IV insertions require inspection as well as palpation. Using aseptic technique upon insertion of peripheral IV catheters, sterile technique for central aids in prevention of adverse infections associated with insertion. Adverse effects of peripheral IV catheters include infiltration, extravasation, phlebitis, and hematomas. Intravenous lines require continuous monitoring and assessment for prevention of complications and for continued patency. In conclusion, intravenous lines are a key part of medication administration in healthcare facilities. As a new nurse, you will learn the basics of medication administration through these lines and continue cared for IVs. Learning to initiate a new IV is a vital skill that you will use in most places you will encounter for your career path as a nurse. Using the skills demonstrated in this presentation, as well as utilizing the information provided to identify an associated complication, will aid you in knowing what to do when complications occur. You will also be able to initiate a peripheral intravenous catheter. Happy sticking to all!
Click this link to watch one student who viewed this presentation successfully return demonstrate how to start an IV.